Hello everyone, I'm Dr. Lakshmi and welcome you all to this session on behalf of Yashoda Hospitals. Amid fear of a possible third wave in this month, our state is prepared to reopen the schools. As many parents are getting prepared to send the children to the schools over the next couple of weeks are confused. What's safe and what's not? Should the school follow any guidelines with regards to precautionary measures? So let's discuss on this topic with our expert doctors here. We have with us Dr. Chetan, Senior Consultant and Lead Pediatrician Intensivist from Yashoda Hospitals, Secunderabad, and Dr. Suresh Kumar, Consultant Pediatrician from Somajiguda. Welcome, doctors. So, sir, as most of the parents are confused if they should send their kids to the school. So, what's your take on this, Dr. Suresh?
Now that majority of them are being vaccinated, I would say at least 40% of adults being vaccinated, and the incidence of COVID-19 in adults is also on the decreasing trend. We can start thinking of reopening the schools. But at this point of time, I would like to tell, let us be very cautious and not overzealous to open all the schools. We can do it in a staggered manner. With the different timings, with the recess of each class being separate as compared to the other class, so that we can reduce the overcrowding as much as possible.
So talking about COVID, we have seen COVID affecting the kids. What do we know about the Delta variant and how different is it? Dr. Chetan?
Sorry, there was some internet issue. I couldn't hear your question.
Okay, so sir, we have seen COVID affecting the kids of all different age groups. So
Yes.
what do we know about this Delta variant and how different is it?
So can you hear us?
Sadhu.
Let's continue with Dr.
For the benefit of audience, probably I will take that question, Dr. Lakshmi. The question is, how different is this Delta variant as compared to the others? When COVID-19 started about 18 months back, we didn't have too much information, or too much of science was not known about the particular COVID strains. But over a period of time, as we got better off with some knowledge about existing strain, a new strain appeared in UK, which was called Alpha. Subsequently, the Beta strain was noted in South Africa, and then Gamma strain was there, which was noted in Japan from people who traveled from Brazil. None of them actually gained as much publicity or seriousness as Delta variant. For various reasons. Delta variant was first noted in Indians, and the difference between Delta variant as compared to the other is the rapidity with which it can spread. That's number one. And number two, the other variants, the previous variants like Alpha, Beta, and Gamma were less commonly seen in those who were vaccinated. But Delta variant seems to be affecting even the vaccinated population. So what we actually noticed and what the literature says is more than 90% of people who are vaccinated, even if they become COVID positive, they would not require hospitalization. Unlike the Delta variant, the percentage of people vaccinated can spread, can develop seriousness of the symptoms, and might require hospitalization.
So, sir, talking about COVID in children, what are the symptoms we generally see in children and which age group is affected more? I mean, are there any different in presentation when compared to adults?
So unlike adults where respiratory symptoms were predominant, children seems to be developing non-respiratory symptoms also. A very small proportion of children with COVID-19 are presenting with respiratory symptoms. In children, majority of the time, we are seeing gastrointestinal symptoms like vomiting, pain abdomen, and loose stools, or even neurological manifestations. Some of them might present with seizures and then altered sensorium. So very small proportion are presenting with the cough, sore throat, and then loss of smell or taste sensation. Unfortunately, it's very difficult to differentiate these particular symptoms from any other viral illness in children. Like most viral illnesses which are common in younger children, like less than 5 years, COVID also can affect, but predominantly it's being seen in adolescent age group, that is between 10 and 18 years.
Okay. So, sir, talking about now the kids, like they're getting prepared to go to the school. I have read in the internet, there are few schools in the USA. They have invested in refurbishing their infrastructure, like maintaining good ventilation and maintaining a good social distancing between the seatings, and also having this plastic barrier. Do you think even we should be following such guidelines?
Given the size of our population, it's massive. So it might not be feasible always to follow these norms, but we need to individualize to our situation. We might not be able to blindly follow what the US or UK has done just because their population and the infrastructure and the ability to change their infrastructure at which a very short notice, it might not be possible in public sector or private sector schools in India. Having said that, we can individualize to our own setup, like reducing the number of students attending the class, like following a hybrid way. Some of them can follow online, and then some of them can follow on-site or offline. Something like Delhi, which has done for traffic, odd and even numbers, something like that we can do. And wherever it is possible, try and make it a little more open, well ventilated, well lit. But having some barriers between two students might not be feasible in our setup. But things which we can do is increasing the distance between two benches, or increasing the distance between two students, and then strictly following that social distancing and wearing masks all the time, and then educating the parents as well as the school staff about those children who have symptoms at its early stages, and advising the parents not to send anybody who is unwell. These kind of things can be individualized and followed in our setup.
Okay. So taking a few questions from our audience, I'll be taking a few questions.
Sure.
So talking about hybrid teaching, so we also have most of our parents who are not yet prepared to send their kids to the school. So would only online teaching, would that be having any mental impact on the kid?
Definitely. Online teaching, which has been going on for nearly 6 months now, we ourselves in our setup, we have seen a lot of children having issues with psychosocial effects. And then we are seeing children with refractory errors. We are seeing children with headache, backache because of abnormal posture. We are seeing a lot of children with these kind of issues. And also it's not same as being in the school, because school for us is teaching discipline. It's not just about learning or knowledge alone, but in a disciplined way, learning is what the schools are meant for. So online alone might not be sufficient. So we need to have a mixture of both online and offline. Now that more and more people are getting vaccinated, get all the school staff vaccinated, not just the teachers, get everybody vaccinated, and then go it in a staggered manner, odd and even roll number. And then we can have alternatively online and offline version, that is hybrid version, that might have a better impact of reinforcing what they have learned in online session while they are on site. That might have a better impact rather than going only for online.
So, sir, talking about vaccines, are there any specific other vaccines like the flu vaccine, which are shown to be protective in the kids, or should we wait until the COVID vaccine is available for the kids?
Vaccines have been there for children for decades, and we have a lot of time-tested vaccines. What we call our routine vaccination program should not be interrupted or disturbed because of COVID-19 pandemic. Having said that, regarding flu, there has been a huge hue and cry about the flu, whether will it protect, the flu vaccine, will it protect against COVID? There have been studies which show that it might not affect as much as what it was thought earlier. But the post-mortem studies in US have shown that those adults who have been affected with COVID and have taken flu vaccination were shown to have lesser impact on lungs as compared to those who are not. So the other thing is giving flu vaccine definitely protects them from flu, including swine flu. So it can prevent from twindemic. That is, already we have a pandemic of COVID. We can prevent a pandemic of swine flu. And then regarding MMR vaccine, yes, it is also very important because over a period of time, studies have shown that whenever there is a lapse in vaccination program, we see rise in these viral exanthematous fevers. So do not stop the routine vaccination because of fear of pandemic. Now, most pediatricians are well equipped with the safety measures to look after children during this COVID pandemic. So everybody needs to contact their pediatrician and get their vaccination schedule completed.
Talking about the safety measures, how long can the kids wear mask and what type of mask do you recommend? Should they be wearing the cloth mask? Regular
Well, kids can wear mask for a few hours at a stretch, but first we have to ensure that they are wearing it properly. And the mask, there are two things in any mask which we need to see. One is good seal, if you can see this. So it has to have a good seal around the facial contours. And second is the fabric which we are using for the mask. So nowadays in our country also we have various certified fabrics by various Indian startups, and certifying agencies are Citra and DRDO, where we have to ensure that the fabric which is used can do the job of filtering the virus. And the second thing is the fit. So fit, basically the nose pin, the loops, so adjustable loops. So these things have to be there, and we have to teach our children first how to wear them and what not to do. Like after wearing the mask, after wearing the mask like this, not to keep touching all the time to the surface of the mask. So adjust your mask according to your, as per these strings, and not anything apart from that. So if the child once, you can do a trial at home, and if the child is able to remain at ease for like at least half an hour or so, then that he can or she can wear the mask at school as well. Then another thing is how frequently one has to change the mask. So all the masks which one is buying, there are instructions how long they can be used, whether they are washable or not. In case of washable masks, ensure that the fit remains good even after the washes, because as you keep washing these washable masks, the fit may not be that good, and the clips and the adjustable strings, they can get damaged. So these things we have to pay attention to, and ensure that the child keeps the mask on whenever the child is asked to speak, and it should not pull the mask down, because that is something which they see adults doing, and they also keep following the same thing.
Okay, Dr. Chetan. So we have already discussed about the symptoms and presentations, how it would be presenting in COVID in children. So apart from that, sir, are there any risk factors in children which they may be having severe COVID if infected, or what are the comorbids increasing the possibility of severe COVID in kids?
Well, in kids also, there are certain comorbid conditions where they may get a severe disease. Largely what we have seen so far, kids don't have the percentage of kids having severe COVID disease like adults. It's very, very less. It's very minimal. But in certain kids, like those who are on chronic therapies, those who are on, say, cancer patients who are on chemotherapy agents, kidney patients who are on certain medications for their chronic kidney problems. Even children do have those, and patients with heart diseases. So these are the ones who may develop, and those who are having immunodeficiencies. These may develop severe COVID. And most important thing is patients who are obese, children who are obese, they may develop very significant COVID complications, or for that matter, any other infectious disease complications can be seen more in children who are obese, who are overweight. So that is something which is a modifiable risk factor or a preventable risk factor, and parents and the whole
So, sir, are there any specific precautions as compared to adults that we should be taking care in children? And what precautions should adults follow at home to prepare their kids for safe schooling? Dr. Suresh?
First and foremost, the precautions are more or less similar. Because now there is enough evidence to suggest that it spreads through droplets, and respiratory secretions are the culprit, and it's not the surfaces which are going to spread this virus infection. So having a tight seal mask and frequent hand washing, and most importantly, like Chetan pointed, not to touch the mask after it is worn, and then do not try and touch nose or mouth. We say avoid touching mouth, eyes, and nose. These are the three things which we should touch frequent touching. Avoid touching men, that is mouth, eyes, and nose, to prevent spread. And coming to the precautions which parents should take, first and foremost, it is a vaccination. Despite the vaccination drive being very, very great pace, there are still a lot of people who have not been vaccinated. They are eligible for vaccine, but they have myths. So it's time to dispel all the myths and get vaccinated. And if any of the parent or an adult at home is unwell with the flu or flu-like symptoms, staying away from kids, getting themselves tested early, and then wearing mask until the results are ready. These are the most important precautions adults should take while they're at home.
And to add to Dr. Suresh's point, first and foremost, we have to Am I audible?
Yes, sir, you are audible right now.
Yeah. So first and foremost, everybody has to follow healthy lifestyle, in the sense the regular physical activity, because for kids as well as even for adults who are working from home, the physical activity has largely got compromised. So regular physical activity boosts your
Looks like we've got some connectivity issue with Dr. Chetan.
Yeah. So basically, regular physical activity boosts their immunity, helps them being safe and then secured. So not just for adults, similar precautions need to be taken for children as well. And a healthy, balanced diet. These are important things which should not be neglected.
So, Dr. Chetan, talking about regular physical activity, how do you think the extracurricular activities during the schooling should go on?
The extracurricular activities during schooling, like in many of the online school, even my kids, they do classes of karate or some sort of physical training at home also, with teachers paying attention to the kids, whether they are doing it or not, or they are just lazing around. So, but what I feel is parental responsibility is they should lead by example in here. And if they themselves show to their kids that they are indulging in a regular physical activity, and this can be a bonding time for the family also. The parents can teach some sort of sport to the child, or can play with them, and have some outdoor activities planned in a manner where we are following the norms, as well as they are actually taking part in some outdoor activities. So when you are in open space, in a huge public spaces, which are open spaces, you can take part in the activity in a very strenuous exercise. There is no problem at all, as long as there are no restrictions. Whenever there are COVID-related restrictions, then you will have to follow those norms. But when there are not, when there are relaxations in place, then I think this is something which every family has to inculcate. And because we have to live with this kind of situation for quite some time in future, but we need to ensure that everybody is having this regular and consistent physical activity, and children don't miss out on this.
Dr. Suresh, you want to add anything to this?
Oh yeah, extracurricular activities doesn't mean just on-site, like Chetan has pointed out, online school physical activity. So when it comes to on-site or in campus, once the schools have been opened for higher level, higher grades schools, they need to continue to have extracurricular activities, because these are the ones which give them space and time for absorbing what they have learned when it comes to curricular things. Like they can follow some things which are healthier, something like yoga, or we can split them into groups and let them participate in physical activity with the least contact, but ensure that while they are wearing mask, they should not be doing strenuous activity because they will be rebreathing their own exhaled air. So they have to be little cautious when they go for strenuous physical activity as a part of extracurricular things in on-site schooling.
So, sir, talking about the extracurricular activities in children, is it safe for them to practice even swimming or water activities during this time?
Oh, yes, absolutely fine. Like I said, there is enough and more evidence to say that COVID-19 virus spreads through nasal secretions. Earlier, when the pandemic started, all of us were paranoid about cleaning the surfaces, cleaning the vegetables, fruits, everything we touch, whatnot. So now there is enough evidence. If we can follow the norms and then avoid overcrowding, the only issue which comes during swimming is if there are more than few people in a pool or in and around the pool without mask, because that's one place where you're not going to wear a mask and go for swimming. So if we can follow the basic norms of wearing mask, that is the mantra. If we can do that and avoid touching men, that is mouth, eyes and nose, we can continue to go for swimming or other activities which are similar to that.
At the same time, we also need to remember that here one has to follow the principle of myself protecting others. So if somebody has got any slightest symptoms of, say, runny nose, throat pain, they should avoid taking part in such activities, because if they themselves are infected, it's very easy for others to get that infection. So everybody has to look after themselves as well as ensure that they are not the ones who are potential spreaders of the virus.
I just put it in this way: everybody has got ethical and moral responsibility towards themselves and others as a society. If we can stick to this, I think we can achieve
avoid the third wave
spread of pandemic. Yes,
absolutely, yeah. So, sir, if a child is tested positive, how do you think the quarantine guidelines should be? Should the entire class be isolated? I think Dr. Chetan, you can take this question.
It all depends, like entire class. If the child is, you're talking about on-site schooling, right? Physical classes. So yes, because if you have got a child who has got tested positive, we need to isolate the contacts of the child, like those who are surrounding the child and the teacher if the child has come into contact with them. Having said that, if the children are wearing masks at all point of time, we need not like give the whole class full quarantine and all, but we need to ensure that what was the situation, like if, because ensuring children wearing mask at all times is something which may not be appropriate for very small young children. So in these cases, yes, we need to quarantine them and we need to observe for any symptoms appearing, and we need to, in asymptomatic children, we need to test them after 4 to 5 days of the initial contact turning positive.
Can I add a few things?
Yeah.
There are guidelines by CDC in this regard, because US was the first country, probably one of the first few countries where they restarted schools. So CDC has come up with certain guidelines, like if one child tests positive and is symptomatic and testing positive is what we are talking about. Wherever there is possibility and feasibility and financial issues are not a concern, the close contacts of that particular kid who is symptomatic and positive should undergo a rapid antigen testing. And then subsequently, they need to be treated accordingly. If rapid antigen test is positive, they should be isolated and quarantined as the index case or the first child. But if that is negative, keep them under close observation, watch for next 4 to 5 days, and if symptoms develop, retest them. Otherwise, they can get back to the normal. But the child who is tested positive needs to be home quarantined, and then they can be back to their normal 10 days after the onset of symptoms and at least 24 hours of fever-free without antipyretic or fever medications. But this kind of definitive guidelines are yet to be released by our Ministry of Health and Family Welfare. But having said that, most guidelines we have been following CDC before our own guidelines come. So this can be taken as one of the guidelines for our setup also.
So in general, sir, what guidelines do you think our schools should be following before reopening it to the kids, like before an pandemic, how it used to be? Yeah.
So if it is like you're talking about the infrastructure and then spacing and the regulations which they should follow, Ministry of Health and Family Welfare have released a few guidelines which are accessible, open access. But what needs to be taken care is vaccinate as many people as possible, maintain social distancing as much as possible, wearing mask, and then frequent hand washing, and avoid overcrowding, which might not always be possible, but wherever it is possible, avoid overcrowding. So these are the regulations. And like I mentioned in the initial part of my discussion, that having a open aired or ventilated, well-lit environment is going to help as compared to closed air-conditioned rooms.
Dr. Chetan, you want to add anything before we end the session?
I think he has summed up really well. So that's it.
So with kids all wearing masks, and that's universal, and with the hand washing and good ventilation, we can get kids back into the school and have it be safe. So I think as a parent, it is, I think it's really important to understand what is your school planning to do and help promote those safety precautions and get the guidelines all done on place. So thank you all for joining. This brings us to the end of the session. I hope all your queries and questions on whether kids should be sent to the school were answered. Thank you and stay safe.
Thank you.
Thank you very much.
Thank you very much.